OxyMBBS, one-step solution for all medical studies.
Hi friends, in this video we will discuss the arterial blood supply to the heart, and I am 100% sure that most of you are very confused about the arterial blood supply to the heart, but from now onward you are going to become very confident about the arterial blood supply to the heart. So our heart mainly gets nutrition from the right and left coronary artery. But my dear friends, before talking about the arterial blood supply to the heart, first it is very important to have some knowledge about the orientation of our heart. So this one is the anterior view of our heart and this one is the posterior view. These are the four chambers of the heart which I am showing from the anterior side, and these are the four chambers of the heart from the posterior side. This one is our aorta, which is taking origin from the left ventricle. And as you can see very clearly that there is a groove present in between the atria and the ventricles on the anterior side, and also there is a groove present on the posterior side, and this groove is called as what? It called as coronary sulcus. And similar to this coronary sulcus, there is a groove present in between the ventricles on the anterior aspect and also on the posterior side, and this groove is called as what? It is called as interventricular groove. So one is anterior interventricular groove and one is posterior interventricular groove. Now in between the ventricles there is a septum present, and that septum is called as interventricular septum, and we have divided this interventricular septum into two parts, the anterior 2/3 part and the posterior 1/3 part. So this one is the posterior 1/3 part and this one is the anterior 2/3 part. And this anterior 2/3 part of the interventricular septum is supplied by left coronary artery, while the posterior 1/3 part is supplied by the right coronary artery. Now the area of the aorta which is coming just from the left ventricle is having tricuspid valve. Tricuspid means the aortic valve is having tricusp, is having three cusp, one anterior and two posterior, and the posterior cusp which is present on the left side is called as left cusp, and that which is present on the right side called as right cusp. And just above these cusp our aorta show some bulging. So these are the bulgings just above the cusp. So the bulging just above the right cusp is called as right aortic sinus, and the bulging just above the left cusp is called as left aortic sinus. Similar to this, there is anterior aortic sinus. As the bulgings are called as sinuses, that is why these are named like this. There is anterior aortic sinus, left aortic sinus, right aortic sinus. Now friends, from the anterior aortic sinus, our right coronary artery takes origin, and from the left aortic sinus our left coronary artery takes origin. And this is our conducting system of the heart. There is SA node, AV node, and in between these nodes, these are the internodal fibers. From the AV node, this is a very thick bundle of fibers coming, and it is called AV bundle or bundle of His. And from the bundle of His, there is coming a right bundle branch and there is coming left bundle branch. And from these right and left bundle branch, these are very small, very tiny fibers coming, and these fibers are called as Purkinje fibers. So the SA node, internodal fibers, AV node, bundle of His, and most part of the left bundle branch is mainly supplied by the right coronary artery, and the very small part of the left bundle branch and the complete right bundle branch is supplied by the left coronary artery. Now how will you remember that? The right bundle branch is supplied mainly by the left coronary artery, while the left bundle branch is mainly supplied by the right coronary artery. So you can remember it very easily. Just write a right coronary artery on the right side and a left coronary artery on the left side. And now just make a crisscross in between the right and the left coronary artery. So this will form a X, and this X will remind you that the left coronary artery will come on the right side and the right coronary artery will come on the left side. So in this way you can remember that the right bundle branch is supplied by the left coronary artery while the left bundle branch is supplied by the right coronary artery. And friends, after talking so much about the orientation of the heart, now you are able to understand very well the arterial blood supply to the heart. So there is a right coronary artery and a left coronary artery. So this is the right coronary artery and this one is the left coronary artery. Right coronary artery takes origin from the anterior aortic sinus while left coronary artery takes origin from the left aortic sinus. Now as soon as the right coronary artery takes origin from the anterior aortic sinus, then it travels along the right anterior coronary sulcus and then from the anterior side goes towards the posterior side along the posterior coronary sulcus and then terminates by going into the interventricular groove on the posterior side. Now let's talk about the course of the left coronary artery. As soon as the left coronary artery takes origin from the left aortic sinus, then it travels a very small distance in the left anterior coronary sulcus and then immediately it divides into two branches. One branch goes along the coronary sulcus and loops around the margins of the heart and goes posteriorly along the coronary sulcus and terminates by forming anastomosis with the branch of the right coronary artery. While one branch of the left coronary artery is going along the anterior interventricular groove and this branch is called as anterior interventricular artery or left descending artery, as this branch that is going along the coronary sulcus is looping around the margins of the heart. That is why this branch of the left coronary artery is called as circumflex artery. Now friends, let's talk about the branches of the right coronary artery. So first branch is the right infundibular artery, then there is SA nodal branch, then there is anterior ventricular branch, then there is atrial branch, then this one is the acute marginal branch, and if there is acute then there must be obtuse, and this obtuse marginal branch is from the circumflex artery which supplies the left side of the heart, and this acute marginal artery supplies the right side of the heart. And if there is anterior ventricular branch, then there must be a posterior ventricular branch, and this is the posterior ventricular branch. Now let's talk about the branches of the left coronary artery. There is left infundibular artery from the circumflex artery. There is atrial branch, there is anterior ventricular branch, there is obtuse marginal artery, and this one is the posterior ventricular branch. Now friends, one very important branch of the right coronary artery is the posterior interventricular artery, and this posterior interventricular branch or posterior interventricular artery is also called right descending artery. And from the anterior interventricular artery or left descending artery, this is the branch coming called as diagonal artery, that is going along this direction, that is going diagonally. So again the branches of the right coronary artery are the right infundibular artery, SA nodal branch, atrial branch, anterior ventricular branch, posterior ventricular branch, there is acute marginal artery, and in the posterior interventricular groove there is posterior interventricular artery. Now the branches of the left coronary artery are the first there is circumflex artery and there is anterior interventricular artery, and the branches of the circumflex artery are the left infundibular artery, atrial branch, anterior ventricular branch, obtuse marginal artery, posterior ventricular branch, and the branch of the anterior interventricular artery is the this one is the diagonal artery. Now friends, these three arteries, one is right infundibular artery, second one is the SA nodal branch, third is the anterior interventricular artery or left descending artery, and the fourth branch, that is posterior interventricular artery or right descending artery, is very important with respect to your PG entrance exam. Okay, so now let's talk about some important points about these branches of the coronary arteries. So the right infundibular artery, or that is also called right conus artery, is mainly the branch from the right coronary artery, but sometimes this artery does not originate from the right coronary artery, rather it originates directly from the aorta and from the right aortic sinus, and then this right infundibular artery is called as third coronary artery. Now friends, in approximately 65% people, the SA nodal branch comes from the right coronary artery, while in 35% people, the SA nodal branch does not come from the right coronary artery, rather it comes from the left coronary artery. So in majority cases, SA nodal branch is mainly from the right coronary artery, while in the minority cases, the SA nodal branch is coming from the left coronary artery. Now how will you remember that? In 65% people, or in the majority cases, the SA nodal branch comes from the right coronary artery. It is very simple. As you all know, the SA node is present on the right side of the heart, and the right coronary artery is also present very near to the right side of the heart. That is why it is very easy to supply blood to the SA node from the right coronary artery. While this SA node is present very far away from the left side of the heart and also from the left coronary artery, that is why if the branch that will come from the left coronary artery, then it has to travel a very long distance. And friends, as you all know, simple or very easy things are most oftenly done. In a similar way, this long distance is not traveled by most of the people. That is why the nodal branch, SA nodal branch, comes in most of the cases from the right coronary artery. And now, as you all know, for the right bundle branch and for the left bundle branch, you have to just make a crisscross like this. So the right bundle branch is supplied by the branch from the left coronary artery, while the left bundle branch is supplied by the right coronary artery. Now friends, in approximately 80 to 90% people, the posterior interventricular artery, or that is also called a right descending artery, comes from the right coronary artery. But in 10 to 20% people, this posterior interventricular artery is not coming from the right coronary artery, rather it is coming from the left coronary artery. So if the posterior interventricular artery is coming from the right coronary artery, then it is called as right cardiac dominance, and if the posterior interventricular artery or right descending artery is coming from the left coronary artery, then it is called left cardiac dominance. So in most of the people there is right cardiac dominance, and if the posterior interventricular artery is coming from both right as well as left coronary artery, then it is called as codominance or balanced pattern. Now friends, as you all know, this is our heart, and this one is the left side of the heart and this one is the right side of the heart. The left side of the heart is more bigger in size as compared to the right side. It means the left coronary artery supplies the major cardiac tissues. So please don't get confused between the cardiac dominance and the majority of the heart tissue supplied by the left coronary artery. whether it is right cardiac dominance or left cardiac dominance, the majority of the cardiac tissues will be supplied by the left coronary artery. Now friends, let's talk about a very important part under the arterial blood supply to the heart, and that is the involvement of the coronary artery and their branches in the thrombotic occlusion, and this part is very important for your PG entrance exam. So please be more focused on this topic. And friends, if you find any difficulty regarding this part of the arterial blood supply, then please ask me, because it is very important. So let's start this important part. So the first most common artery which is involved in the thrombotic occlusion is the anterior interventricular artery or left descending artery. And because of the occlusion, the parts of the heart which are infarcted or which are affected are the anterior wall of the left ventricle. This one is the anterior wall of the left ventricle. Apex of the heart, this one is the apex of the heart, and the anterior 2/3 of the interventricular septum. It means the major part of the cardiac tissues are supplied by the anterior interventricular artery or left descending artery, and its short form, that is LDA, is most commonly used. And because of it gives supply to the major part of the heart, that is why if that artery undergo complete occlusion, then it may cause death of the individual. That is why this artery is called as widowmaker artery. So which artery is called as widowmaker artery? So this one is the anterior interventricular artery or left descending artery, and this is the first most common artery which is involved in the thrombotic occlusion. Now the second most common artery which is involved in the thrombotic occlusion is the right coronary artery or its branch, that is posterior interventricular artery. And the posterior interventricular artery is also called a right descending artery, and its short form, that is RDA, is most commonly used. And if these arteries undergo infarction, are affected, then the posterior wall of the right ventricle, this one is the posterior wall of the right ventricle, and the posterior 1/3 part of the interventricular septum are affected, are infarcted. Now the third most common artery which is involved in the thrombotic occlusion is the circumflex artery. And if the circumflex artery undergo thrombotic occlusion, then the lateral wall of the left ventricle is infarcted. So this one is the lateral wall of the left ventricle. As the apex of the heart is supplied by the anterior interventricular artery or left descending artery, that is why the apex part will not be affected if the circumflex artery undergo occlusion. Now the acute marginal artery, the obtuse marginal artery, the main left coronary artery, the diagonal artery, so these arteries are very rarely involved in the thrombotic occlusion. So one is left coronary artery, one is diagonal artery, and the marginal branches are very rarely involved, very uncommonly involved in the thrombotic occlusion. So friends, this is the anterior view of our heart, and this one is the posterior view of our heart. This one is the interventricular septum. This is the left atria, this one is the left ventricle, this one is the right ventricle, this one is the right atria on the anterior side and on the posterior side. This one is the left atria, this one is the left ventricle, this one is the right ventricle, and this one is the right atria. Now the most part of the right side of the heart is supplied by the right coronary artery, but a very small part of the right ventricle on the anterior side, which is just associated with the anterior interventricular groove or anterior interventricular septum, is not supplied by the right coronary artery, rather it is supplied by the left coronary artery. And similar to this, on the posterior side, this part of the left ventricle which is associated with the posterior interventricular groove or posterior interventricular septum is supplied by the right coronary artery. So this yellow colored part is showing that this part is supplied by the right coronary artery, and this green part is showing that these parts are supplied by the left coronary artery. So friends, this is all about the arterial blood supply to the heart. Now friends, if you have any queries regarding the blood supply to the heart, then friends, feel free to ask me in the comment section below. And friends, if you really gained something from this video, then please share this video as much as possible to your friends, and I hope this video will help you in remembering the arterial blood supply to the heart. And in the last, thanks for watching this video, and I wish you all the best for your bright future.